The cholesterol myth. Yes, it's the much maligned molecule in your body. What's going on, Secoya Nation? Dr. Schilling bringing you today's wellness wisdom. It's not Wednesday yet. Close Tuesday. So we're talking about cholesterol. And if you're not familiar with cholesterol, it is a molecule that has been labeled as a bad guy. It has been said to be the problem for a lot of cardiac issues, cardiovascular issues, and things like that. So, the question is, have you ever gotten blood work done and had a doctor or some healthcare provider tell you have your cholesterol's off, it's high, it's something like that? Is it related to the good cholesterol, the bad cholesterol? Which cholesterol is it? Is it HDL, LDL, VLDL, total cholesterol, blah, blah, blah? So, of course, human psyche says we want to blame one thing for everything. Like, my problem is coming from this, so I can reconcile myself and say, oh, I can put all my energy into this one thing. But no one thing causes any one thing. If you haven't heard that before, I'm here to tell you. So we're thinking about a participant named Kenny who came in the other day for cholesterol. He has a history of family, what's that called? Familial hypercholesterolemia. A fancy word of saying, like, there's supposedly some genetic trait that says, my family has high cholesterol, I have it, I'm screwed. So I have to take statins for the rest of my life. And if you're not familiar with the documentary series, or it's a documentary film called Statin Nation, for any of you interested in statins, look at Statin Nation. It'll blow your mind. It's kind of like the book, The Price We Pay, that Anissa has, and it's a great book. The Statin Nation documentary film will tell you all about the insidious beast that is the statin industry. I have predicted before, and I haven't seen it yet, but the class action lawsuits that will come against statin drug makers, at some point, I think they're coming.
Similar to Dope Sick.
Yeah, Dope Sick is another great one. So tune into that. Fantastic stuff. So as we dive into these topics, always remember, like, I'm the first to admit no one thing causes any one thing. So if you have a cholesterol issue, my opinion is, and what I've seen clinically, is that you have a multifactorial issue. Something's driving cholesterol up. Okay, so always consult your medical provider, your healthcare provider, whoever you work with, in order to get the wisdom and the information you need and get yours tested and get a perspective. I'm going to give you a GNM, German medicine perspective on what cholesterol means and how it fits in your body, but it's always important to say, is this relevant? Is the healthcare practitioner helping me understand what the root cause is, or are they just telling me, like, I gotta manage some type of lab marker, because it's not enough. If you want to work with one of our doctors, either Dr. Jessica or myself, just check out our website and look at information on there, and we'll be happy to help you any way, shape, we can. So, good cholesterol, bad cholesterol. I don't think there's anything good, bad, right, or wrong with your body. Your body doesn't make mistakes. Cholesterol. So first of all, the body is estimated to have between 30 and 50 trillion cells. Every one of those cells uses cholesterol in some way, shape, or form. It's like a backbone. It's like a scaffolding. It's the backbone for your steroid hormones. It repairs like a Band-Aid on the inside of your arteries. So there's way more to this than meets the eye. So labeling it as bad, or this one molecule of cholesterol is bad, it's way oversimplifying it, but that's how human psychology wants to latch onto something and say, this guy's bad, we're going to blame it for our problem. We feel better about things because we know who the bad guy is. Because if you don't know, like, there's a serial killer out there, you can't find him, you feel scared. Like, but now I know it's cholesterol, so now I can blame the cholesterol for it. So just be mindful. Any time someone tells you something's wrong with you, or that you have a condition or a lab marker out of place, compel them to tell you why. If they can't tell you why, then say, hey, I'm going to shake your hand and kindly fire you, and I'm going to move on to someone who can tell me why and what to do about it and how to resolve it and never not have it coming back again. So just plug for your own safety there. So, cholesterol from a GNM standpoint is like, it all comes from my actions. It's dependent on me. I have to take the action to make it happen. I have to count on myself alone. Like, that's the concept. Like, remember, it's the scaffolding, it's the support structure, it's the thing, it's the molecule that everything's based off of, as far as like your support network and things like that. So, whether you're being compelled to do something, you're forced to be doing something, it's like you feel obligated to harmonize your family. That's another way of, like, cholesterol can, like, so for Kenny, he's always been the harmonizer in his family. So this is a perfect example. Just happened to coincide that I saw him recently. And so he felt responsible for being the harmonizer because he was the oldest son in the family, or his oldest son in the family, and he was always the one responsible for, making sure everybody was taken care of and harmonizing and tending to the herd and bringing over little kitties over here while mom, was dealing with the next baby or whatever like that when big families happen. So cholesterol is like the strength that ties the family together. That's the the concept, if you will. So take that for what it's worth. When we have elevated cholesterol, so think about, people aren't going to pay attention to this until they have elevated cholesterol, and then they don't know why, so they have to blame the molecule. But use these little nuggets as understanding the deeper meaning as to why your cholesterol or someone you love's cholesterol might be elevated. Okay, so when we have a conflict regarding achieving something on our own, like, do I have the strength? Can I assert myself in my territory? How can I delineate myself? How can I mark my territory? How can I accomplish something on my own? That's kind of another thread of cholesterol. So, whether it's you harmonizing the family, doing something on your own, feeling compelled to do something, these are three. Just go listen back and see which ones are relevant for you. Share it with your loved ones so they understand that there is a deeper meaning to the molecule, and it's not just, you got bad cholesterol and you're screwed. Okay? You're going to have a heart attack or having a stroke or something like that, and things like that. So take that in consideration. If you need help analyzing your functional labs, get on the phone with us. We'll take a look. We use a functional range. So if you know things like a bell curve, for statistics, the wider the bell curve, the more people that fit under the quote-unquote normal range. So a laboratory range is going to have a really big bell-shaped curve. So a lot of people fit under the normal range, which means fewer treatments are applied or prescribed, and then their insurance company's not going to pay for it. They're issues, if you will. If you understand, like, a functional range takes that bell-shaped curve, which is way out here for America or other places, and shrinks it down to a more functional range. It's a very specific and much more narrow band of optimal health, because you don't want to be like, I'm okay. You want to be healthy, right? That's why you listen to this stuff, because you want to be healthy and you want to be informed and you want to understand these things. So take the range, and we're going to put it in a functional range so we have a much tighter band, and you can have a better perspective of what is my overall health, right? Total cholesterol is thought to has to be under 199, but under 199. So, but I can tell you that anywhere between even up to 299, 300 is perfectly fine, because our body's going to make the cholesterol. You cannot eat enough food to raise your cholesterol. So the idea of the sausage and the eggs and other crap that has cholesterol in it, you cannot eat enough food to raise your cholesterol, okay? You want to understand your body's making it as a manufacturing tool to support your body in its healing and its repair, okay? So yeah, sign up, for the YouTube or the Facebook or whatever, TikTok, if you want to get more of these videos, because we're trying to put out content that you've asked for. Kenny came in with his cholesterol, and you asked for cholesterol, but it's a big myth. It's a big myth. People are misunderstanding it. They're misinformed. So we're trying to bring you information that you're not going to hear anywhere else. And so we just appreciate the opportunity to bring that to you, and take the wisdom from the ancients and the wisdom of the greats that have done the research and done the studies on the German medicine side, and bring it to you. So appreciate you. Love you. Consult your medical physician if you have questions about your cholesterol. Give us a call if you want help. All right? Have a good night, guys. We'll see you tomorrow.